I'll throw in an IVF example. So you go in for your baseline ultrasound, you have an ovarian cyst. So you're going to see that and you can take it in different ways as a way to learn from it and say, I'm going to continue to take care of myself. Or you can take it and think of it as the worst thing that's ever happened into your life and allow it to let you spiral.
What you're saying is it's either happening to you, you spiral, or it's happening for you. However, be kind to yourself because your reaction to that ultrasound was not what you didn't choose that. That comes from your program, your lenses, and it is a supercomputer. Your subconscious is fast.
Welcome to the Egg Whisperer Show. I'm so excited to have my dear friend, Dr. Lorne Brown, on today. Welcome back, Lorne.
Thanks a lot, Dr. Aimee. I'm excited to be back with you today as well.
We're going to talk about conscious fertility and psychoneuroimmunology and new mind-body tools and methods that can support fertility patients. We'll also be talking about how mindset can help fertility patients on their path to pregnancy. Let me tell you a bit about Dr. Lorne Brown. He is the founder of Acubalance Wellness Center in Vancouver, British Columbia in Canada. He left his career as a CPA to receive a doctorate of traditional Chinese medicine, also known as TCM, at Vancouver's International College of Traditional Chinese Medicine, and then continued to pursue training in hypnosis, functional medicine, cold laser therapy, and Psych K, allowing him to offer an integrative approach to assist the body's innate ability to heal pain, digestive disorders, anxiety, hormone imbalances, and reproductive health issues. Welcome to the show, Lorne.
Hey, Dr. Aimee, I'm glad to be back on again as well. And I always enjoy talking with you. And my patients adore you, by the way. They always tell me they don't know how, but you always find ways to have time for them. They feel heard. You answer their emails. So kudos to you as well.
Thank you, Lorne. You're very, very sweet and very kind. Thank you. So the last time you were on the show, we talked about acupuncture, and I'll link that up in our show notes or down below on YouTube. Let's do a quick overview on how acupuncture can be used in support of IVF and transfers. What kind of acupuncture do you recommend for fertility patients?
So, in that last episode, and to answer that question, we talked about like nourishing the soil is kind of the idea in Chinese medicine before you plant the seed. And that idea, soil be a metaphor for your cellular environment. And so I'm actually not attached to acupuncture per se, although I'm trained in it. I'm a fan of anything that can help the cellular environment to increase blood flow, regulate hormones, lower oxidative stress, improve nutritional deficiencies, inflammation, mitochondrial health, so overall cellular health. And so when it comes to what kind of acupuncture, there's many styles, and the style that you're looking for, the goal is, do we see a regulation in hormones? Does the cycle change? If they have irregular ovulation, do they start to ovulate regular? If they have pain or clots or very light or heavy menstrual cycles, does that change? Because in Chinese medicine, a healthy cycle has no pain, no to minimal PMS, no clots, and you bleed 3 to 7 days. And so the kind of acupuncture I like is seeing people once or twice a week, and it's usually a good 3 to 6 months sometimes that we're working with them to see that shift in the cellular environment that shows up in the physical symptoms. One of them being the menstrual cycle, and the ultimate one is pregnant having a live birth.
So you're basically hypnotizing the uterus, is what you're saying.
Yeah, I'm hypnotizing them. I am trained as a clinical hypnotherapist, so it's funny you say that because I am doing that in a lot of my patients, which I call conscious fertility work.
Yeah.
So I am doing the acupuncture with some hypnosis. So it's funny that you said that.
Yeah. I mean, the thing is, when I tell patients about acupuncture, I say, like, I really want you to look forward to doing it. I really want you to feel better when you come out of it. If those two things are satisfied, you look forward to it and you feel better coming out of it, then continue it.
Yeah.
If you're not, that might not be the right place for you. So it might be good to maybe get a second opinion or maybe consider another way of improving mood and decreasing stress. And then there are some studies that have determined that acupuncture has a positive impact on IVF. What are some of those findings that you've read about or learned about through your work?
Yeah, I think since 2002, that's when it first started with IVF on transfer day. The most recent meta-analysis that I looked at the time of our recording was the one published in July of 2023, and they looked at over 4,700 people going through IVF having acupuncture. And their conclusion was it increased implantation by 28%, pregnancy rates by 33%. The most important one was live birth rate by 33%, and it decreased the risk of biochemical pregnancies by half. And also, there's been research where they've shown acupuncture during IVF setting lowers the anxiety level.
What are some herbal supplements? Do you have any favorites? What do you tell patients?
A healthy prenatal, a good prenatal, CoQ10, inositol. I like N-acetylcysteine as well. It's quite common that I prescribe for my patients. Omega-3, some that are not familiar for people, but they'll know this. Magnesium, I like magnesium a lot. And vitamin D3 with a K2 combined. And then depending on what endometriosis piece, whatever else is going on, we may add things. But if you ask me what are the most common 5, those would be there.
Yeah, I usually share the exact same list with my patients. I usually add 2 more things for the patients who have lower egg quality, or even if they don't, and that's NAD or nicotine NR, NAD, and resveratrol. So those are the 2 that I also add.
Nice.
So, yeah.
Basically, I'd like to learn from you as well. So with the NAD, we haven't brought it into our clinic yet. There's oral and then there's IV.
Mhm.
Um, we're not confident yet that the oral is going to do its trick. Our naturopathic doctor is concerned that it's going to get stuck somewhere on the pathway. So you're going to have short-term benefit and then later issues. So she prefers the IV, but we just haven't brought it into the clinic. What are you doing and what do you think?
Oral is best.
Yeah. Okay.
I'm so funny. I am a brand ambassador for this brand, and it's True Niagen.
We're
And
familiar with that. Yeah.
so, yes, I think NR is the best way of increasing NAD in our cells.
And then resveratrol, again, our naturopathic doctors that love to geek out, they like that one, but they don't do it for frozen embryo transfers because somehow it may impact with implantation. So they do it for egg quality, but they don't do it for getting close to a transfer.
1,000%. It's part of my beauty line for the eggs. When it comes to my beauty line for the uterine lining, I have a whole nother,
All different things.
set
Good.
of things.
I'm getting like little excited goosebumps as we chat because I'm thinking back to like in 2002 is when I really got into the reproductive health. I was been in practice since 2000. And back then, REIs threw me out of their clinics, right? Well, it's different now. This is why I like talking to you because things change. But why I'm getting goosebumps is I'm sitting here because I always wanted integration. I dreamed of the day that it was integration. And I'm sitting here and you know about resveratrol. It's not that you heard about it and you have, your beauty line and your egg quality line and your and the implant. That's why I'm having goosebumps that here you are as an REI. So for the patients that are sitting here that your REIs are not integrated enough, man, you don't want to go back in time. You have no idea how good it is in 2024 when we're recording this.
So, what are some mind body tools that we may not have heard of yet?
Yeah, well, if you're okay, I'll probably get a little weird too, if that's okay. I
I'm
think you're okay with
totally
that, right?
into weird. Yeah. Yeah.
I
Totally.
like to live in both worlds, my head in the clouds and my feet on the ground. And I know we're going to talk about PNI later as well as part of this. So when it comes to mind body
Careful
tools,
what you say. Some people might not know that PNI stands for psychoneuroimmunology, everybody.
sure.
Okay.
So the mind body tools, I kind of share why they're out there, what I would look for, because I'm always like, why are we doing it? Versus like just like, do I need acupuncture? Well, what are we changing in the soil? What are we changing in the cellular environment? So why do we want a mind body tool? And so there is the materialistic view and the quantum view, the Newtonian view and the quantum view. So the materialistic, where we're going to talk about psychoneuroimmunology, the physical shifts in your body from stress, and then there's a spiritual component. And on my podcast, the Conscious Fertility Podcast, I bring on credible people, as in they're trained in neuroscience, they're physicists or quantum physicists, they're PhD in psychology. So I know they're grounded in the materialistic view of the world. That's their training. And then they're also talking about this thing that's getting the term consciousness. And so there's things that are happening beyond our 5 senses, call it the sixth sense. And this is where I say miracles happen, or you tap into your higher self. Okay. And so when I say talking about mind body tools, how do we remove this filter so we can access our higher self? And the metaphor I've heard other teachers of consciousness talk about is, there's the sun and you love the brightness and you love the warmth from the sun. But today it's full of dark clouds. So you feel cold and you don't feel the sun. The sun's always there, but in your mind, it's not there. I've lost connection to it, but it's there. And you have to part the clouds to re experience the brightness and the warmth of the sun. So, any mind body tool that can help you part the cloud so you can reconnect to your higher self are tools that I would recommend. And there's many out there. And so, the tools I use based on my training as a clinical hypnotherapist and trained in Chinese medicine, and then just all the other little certifications I've done in my own personal experiences. I just one day had my, I guess, call it access and my download. And I developed an approach that I call notice, accept, choose again. And the intention here is it helps you develop emotional resilience. Basically, it's how to be present so you can deliberately create a reality. And for the listeners that don't know, you've probably heard of the author Eckhart Tolle. He wrote the book, The Power of Now. He lives in
Mhm.
my city of Vancouver. And when I read his book, when you're present, you don't suffer and you have peace and joy, I was like, I want some of this. But I'm that left brain guy. You remember I used to be the CPA and I was like, but how do I have this presence, right? And everybody I would learn from, I'm like, how? And one day after all the retreats, all the program, eventually one day it dawned on me that all of them are doing this: notice, accept, choose again.
Say that slower for me.
Notice, accept, choose again.
Notice, accept, choose again.
Since we're on the NAC approach, I'll just explain that then. Okay. So it makes sense. So when you go unconscious, you're at the effect of the situation, right? The external world is impacting you. And so you suffer, right? But if you can become awake, be conscious, then you can interrupt that story. And I can't think of the author right now, but his quote kind of goes like this: every situation, you either habitually, unconsciously react, or you can consciously choose to respond. So in every situation, and the reaction that comes out of you is from your programming. You came into this life with some programs, and then based on your sex, your religion, your culture, your nationality, and then your parents consciously or unconsciously imprinted programs on you and society, and you develop these programs that you run, and your behaviors are always congruent with your beliefs. So that's why, if you try to lose weight, dieting is not going to work because you got to go after the program. If you fix the program, then the behaviors will change, right? So we always like to work with the subconscious. Going to the notice, accept, choose again, then what are all these teachers of consciousness sharing? In my opinion, what I distilled it down to: first thing is to notice everything that happens is neutral, and then we give it meaning. We're meaning makers. And the meaning we give it is through the lens of our subconscious programming. So if we change the lens of our program, the perception of what is happening is different. For example, let's say reality is white snow, but I have red glasses on, you have pink glasses on, this person has green, blue. Everybody is seeing the white snow, but everybody's perception is different based on their lens. So you change the lens, you perceive reality different.
And I'll throw in an IVF example. So you go in for your baseline ultrasound, you have an ovarian cyst. So you're going to see that and you can take it in different ways as a way to learn from it and say, I'm going to continue to take care of myself. Or you can take it and think of it as the worst thing that's ever happened to your life and allow it to let you spiral.
What you're saying is it's either happening to you, you spiral, or it's happening for you. However, be kind to yourself because your reaction to that ultrasound was not what you didn't choose that. That comes from your program, your lenses, and it is a supercomputer. Your subconscious is fast. You're not thinking anything. You're riding your bike, you're driving your car, but the subconscious is doing all this. You've probably all have experienced where a ball or a crow almost hit you, and without you thinking about it, you moved your head. You didn't think about it. So just so you know, your reaction is unconscious. This is why we want to prune the wiring, the synapses of these old programs, and rewire new programs. So in that quote, I said, in every situation, you unconsciously habitually react. It's a program. You didn't get to choose it. It got imprinted on you. Or you can consciously choose to respond. NAC is how we interrupt the story. And so we notice, and it takes practice. So the first couple of times, you're going to only do this an hour a day or a week or years later on an event that happened that you're still triggered by when you remember it. Everything that happens is neutral, and we give it meaning. Notice, when you believe in the story, you make it real. So it's a story and you're believing it. I have a cyst and it means this, and now you suffer. So the second step, which is counterintuitive, is to accept what is. When you fight with reality, you create resistance. In Chinese medicine, we call this qi stagnation. When there's stagnation, there's pain and disease manifest. And when we have free flow of chi, we have health. And so resistance does not feel good, but when you can fully accept what is, and I have tools for this. So this is what I do in the A part. It's conscious work. It's working on the subconscious that we surrender, accept what is. This lowers the resistance. And this is the key part. These uncomfortable feelings, fear, anger, not good enough, alone, they can act as portals to take us into presence. Now we go back to, Eckhart Tolle, be present. And when you're present, when the resistance drops and you're present, that feels good because you now have flow and receptivity, and now inspired thought can flow through you, which leads to inspired action. When you come from fear and lack, you will take action, but often that action will lead to more fear and lack. It's what is your beingness? When you take action from flow and receptivity, from that state of love and feeling whole and complete, you'll get more of that. So the key really is, how do we lower resistance? We accept what is. And again, I use tools to help you get into present moment. Again, they're tools, they're gimmicks to help you get there. Eventually, you figure this out and you can do it in real time. But at the beginning, some of us that are left brain, we need to do to get into beingness, Amit Goswami, who wrote The Quantum Doctor and the Quantum Integrative Practitioner, I interviewed him on my podcast as well. And he calls it do, be, do, be, do. And I was like, that's the NAC. We do to get into being. And then from that beingness, we can take action.
Right.
So the accepting is the key part, because the accepting allows you to lower the resistance, to surrender to what is. And it does not mean you're resigned to the situation. It does not mean that you like it. You're just being authentic. Right now, I feel afraid. That's it. And that takes the charge out of it. Sounds counterintuitive, but what you're doing is you're practicing or developing that ability to witness, observe, because your very nature is peace and joy. You are not your thoughts and feelings. You are not the cloud, the thoughts and feelings. You are the rays, right? And your very nature is peace and joy. And so by developing, strengthening, practicing the witnessing, which we do in surrendering, accepting what is, eventually you tap into what these experts that I have on my podcast call your higher self, something greater than self. And that's when it feels like these hands from the universe, from heaven, come down and do things for you. All these synchronicities happen.
Yeah.
And then the choose again is, once you're in a state of relief or peace, now you can deliberately choose again. So going back to that quote I shared with you, Viktor Frankl's quote, it's a modification of Viktor Frankl's quote, Man's Search for Meaning. In every situation, you unconsciously habitually react, or we use NAC to interrupt it. You can consciously choose to respond. Every day when I work with somebody on the fertility journey, it always starts with the fertility journey. And then we gently, and I emphasize gently, regress back. Remember, I have some training in clinical hypnotherapy. It's never about the fertility. There's always some form of trauma from their childhood, and they heal that. And when that resistance comes down, now they get to choose how they want to be and feel in this world. And that's part of the rewiring. And now they're not coming from lack or fear anymore. And so that is the NAC approach. And so when you ask me what kind of different mind body tools, that's my style. But there's guided meditations I share with patients. We want the ones that have really good hypnotic language, because there's guided meditations that will relax you, which is key. We need to relax the body, get out of sympathetic into parasympathetic, get out of high beta into alpha or even theta brainwaves. That's how you get into the operating system of the subconscious. So it's beyond just relaxation. And that's why I like some of the guided meditations that are out there that help relax you and then start to change the programs that you have been given.
Yeah. And your notice, accept, choose again method is very similar to the method I use for patients. So I always ask them, what do you want? What is it going to take? And are you willing to do it? So you have to notice what you want. You have to accept what it's going to take. And if you're not willing to accept it, you have to choose again. That's just the gentle reality. And I love what you say about things are happening for you. So I teach my patients this float through life type of mentality. You can't fight the current, but if you take that float through life mentality where things are not happening to you but for you, and you're just kind of going with the flow, your fertility journey will be a heck of a lot easier.
Yes, because you're going to get to whatever that destination is,
Yeah.
and you can either go kicking and screaming,
Or with a wicked sunburn. Just
right?
kidding.
Right? Or you can get there and it doesn't have to be suffering. And what I share with the patients, the metaphor I've come up that works well for me and them is if you ever canoed or paddleboard and you're out on a calm lake, so that's you at peace, and then a speedboat goes by and all of a sudden these waves come. So life's going to happen. People think if I do this I'll always be happy. Yeah, just want to change those expectations. Shit's going to come to you, don't worry. The question is, how do you ride the waves? And what's supposed to happen as a human experience is when you have this situation, these emotions are meant to go through you 90 seconds to, to 3 minutes. But we have that, brain that we suppress it or we project it out. So it gets stuck in our tissues. Right. And so it's constantly impacting, and rather than have gone just through us and then we're back at peace. Back to the metaphor is, it's counterintuitive. I remember when I was a young child, and then when I was a counselor, when the waves came and my staff member said, everybody turn into the waves. And I was like, no, we should get away from the waves. And what happens is it's harder to experience those waves on the side of the canoe or paddle boat versus front straight at it. So it's counterintuitive to go into your emotions, accept them and experience them, observe them. It takes courage to feel these feelings because you still have to feel these feelings. It's just, I promise you, they don't last more than 90 seconds or 3 minutes when we do this work. And then when you're on the paddleboard, say, the waves still go up. It's like, whoa, whoa, right? But you're okay. You're not being flipped over. And then eventually, over 90 seconds to 3 minutes, the waves pass, and now you're back on calm lake and it's peace again. And sometime in an hour or 2 hours, another boat may go by, and here's whoa, and you ride the waves. You have an ultrasound, there's a cyst, whoa, the waves. So ride the waves. We're not saying, oh, I have a cyst, that's great. We're not doing spiritual bypass here. We're being authentic. It's, if you're angry, notice you're angry, accept you're angry, and then the choose again. Once that relief happens and the resistance is lowered, then you choose how you want to respond.
Absolutely. And see it as something that's happening for you, not something that's happening to you, and use it as an opportunity to grow and to imagine those clouds opening up and feel the rays of sunshine.
The word is opportunity. Your infertility is an opportunity to grow. It's a wake-up call. Some people get cancer, some people get a divorce, some people have financial disaster. They're always, it's an opportunity. I don't call them a gift because nobody would ask for that. So don't call it a gift. You know, but life happening for you, it's not always roses, but those are big waves that happen. So this work gives you emotional resilience. So when life throws you, the cliche, lemons, you make lemonade.
Right. And so many patients going through fertility, their first interaction with the medical world is as a fertility patient. And a lot of them haven't developed these skills. So I think patients who are starting their journey should really use this as an opportunity to think of this as a spiritual journey and to learn as much about themselves and how to cope and build resilience at the same time. So hopefully everyone's going to listen to this episode because I'm certainly feeling so inspired and learning so much from you. And I'm going to use a lot of the tools that you've taught me today with my patients. So I want to talk about psychoneuroimmunology. First of all, what does that mean?
So your thoughts and feelings impact your endocrine system, your hormonal, your nervous system, your immune system. That's basically what it's saying. So basically, that modern medicine has now confirmed, validated what the sages have said for thousands of years, that your mind body connection. But God forbid they would actually say, hey, there's a mind body connection. They like to give it a nice term called PENI, psychoendo immunology, whatever. So it makes it sound, so now they don't sound so woo. It sounds very medical. Like, of course this is true.
And of course, it affects your cortisol levels. It affects your sleep, your relationships with people, your relationships with yourself, everything, your pain, your periods, your quality of ovulation, everything, your implantation window, everything.
If we just follow the mechanism, you have a stressful event, the body perceives it as an alarm, then you have the body reacting. So here's the hormonal, immunal approach. So you release, body's an alarm, so it releases cortisol. Cortisol affects blood sugar regulation, which can affect other hormones, leads to chronic inflammation, which we know chronic inflammation can lead to many diseases, which can also lead to suppression of immune system. So now you have all these stress hormones, which turn on and off genes for disease and subfertility. If you're able to experience the joy and lower the resistance, so feel safe, not an alarm, then you get more of the serotonin, oxytocin, dopamine, which turn on and off genes for healing, longevity, and reproduction. So when you have a thought, we talked about the lens, so you have a meaning because it's never the event, it is your perception. For example, look, there are certain things that happen that no matter how sensitive or not sensitive you are, you're going to be affected of it. Child abuse. But there are certain things people come into this world very sensitive. And it's a common thing in my practice when I regress people that their abandonment comes from their parents showed up late picking them up from daycare, right? That's their abandonment. Somebody who's not that sensitive, that would not impact that child. But if you're born really sensitive, that can do that. And so it's how you perceive the situation that causes the stress inside the body. And it's more and more documented that fertility causes stress or trauma, can be perceived that way. So that's be my simple reason that don't ignore your thoughts and feelings. It's like a little smoldering fire underneath, and every once in a while it burns up.
And I just literally tell patients happy eggs are healthier eggs, and just believe that. So, like, I'm a total weirdo too. I accept it. And I, tell my patients, your eggs are so beautiful. And if they have a partner there, I say, please talk to their eggs and tell them how pretty they are. And I want you to truly believe that. And there's just something about it. And I feel like, of course, not every person that tells their eggs they're beautiful is going to end up with a healthy embryo. But I feel like just that the positive affirmations that you give yourself, I think it's part of the PENI method, so to speak,
Yeah.
that can help patients with their overall health.
Be kind to yourself is what you're saying. Love yourself.
Yeah.
Take your fingers, kiss them, put them on your ovaries, kiss your ovaries, right? Be grateful for them,
Oh
right?
man, I'm gonna have to steal that from you,
Go.
Lauren.
I'll tell you where I thought of that is I was listening to a TED talk and she developed brain cancer and she took up a relationship and started practicing gratitude for her brain and kissing her brain. And right away, because of what we do, I was like, yeah, kiss those ovaries. Have gratitude for them. They're working hard. They're trying their best.
Oh my God, where have you been my whole life? This is incredible. Yeah, I'm all my patients are gonna be walking around kissing their ovaries.
You listen, a week ago, so weird. There's people I've interviewed about remote healing and remote viewing. So, while your embryo's sitting in the lab trying to grow out to blastocyst and you're thinking it's not going to work and you're freaking out and crying, that's the notice, accept, choose again. Notice, accept. So have your tears, bring the resistance down, surrender, then choose again. Why don't you send some loving thoughts to that embryo in the lab and not be attached to form an outcome as part of consciousness? So, I'd love to be your parent. If I'm the right fit, enter this body. Let's do this, right? Send it love, unconditional love, whatever you can do. When you do the affirmations, the key is to have those good feelings. And so I talk about like baby manifestation or manifestation in general. And this NAC is like step 4. So the first step is knowing what you want. I call it setting your GPS with the end in mind. So having a baby. Then you add an emotional charge behind it. So I bring this up because you have to feel it. If you're sitting there kissing your ovaries, but you're in fear and lack, and then that's not doing anything. It's the emotions that puts the charge behind the thought. That's like the beacon that goes out there. So if you're saying, I believe I have a baby, but your subconscious says, no, I don't, no, I don't, then you're not sending anything out there, right? So really to put it on a cellular level, you have to dismiss the current reality temporarily and allow yourself to imagine the future as if it's now and that you have your baby and what will be different. And the litmus test for any type of manifestation is when it arrives, you don't feel differently because you've been practicing that feeling all this time before it arrived. So when it arrived, you've already been feeling that way. There's no like, oh, it's not a surprise. And so the emotions are key. Then you get into the state of believing it's going to happen. After you practice, it's happened. And then step 4 is if you feel the resistance, like you just don't believe it, and you got these nagging thoughts and feelings, then we NAC that underlying belief or feeling. And then when the resistance drops, we go back into the steps again, which is to choose again, set your GPS, feel it, believe it. And then remembering not to be attached to form an outcome. And to me, that is that this or better is going to happen to me. So if you're attached to form and outcome, then you're trying to play the universe, God energy. So be open to other ways for things to come to you that bring the joy, bring the love, bring the purpose, whatever it is that you think it is. Don't restrict yourself, because conscious work requires you to be in the unknown and uncertainty, which doesn't feel comfortable because it's unfamiliar. It's not that it's bad, it's because it's not familiar, it can feel uncomfortable.
I love you, Lauren. We should do this more often. So tell us more about your practice and where people can find you.
Yeah, I'm practicing in Vancouver, BC. So it's Acubalance Wellness Center. And I do conscious work online as well. And I have the Conscious Fertility podcast. So I invite people to tune in. Um, I'm on Instagram, LinkedIn, Facebook, so they can find me there.
So tell me more about the one-on-one work you do with patients. So if I have a patient that lives in California, for example, how do they work with you?
If somebody is out of town, then they just set up a telehealth. And what I do in those, I have an initial consult, I get their history, and then we find out what we can do to nourish the soil. And so they may want to know about supplements, Chinese herbal medicine, acupuncture, laser, IVF. And that's where I share the resources that I have around the world, because I can't do the acupuncture laser if you're out of town. Some of them do come into town and see me, but for out of town, I direct them, oh, here's people you can go to. Hence why you see a lot of people that I've referred, because I'm like, oh, you want some PRP? Check out Aimee. You want the Tushy method? Check out Dr. Aimee. So I can do that remotely. And I basically am like they want a second set of eyes. Sometimes they're seeing somebody, and I just go through it and see what they're doing. And then I can share other things that they could be doing. And then if they want to do the conscious work with me, the belief change work, they just set up a series of sessions online. And usually we do at least 5 sessions. That's common to do 5 sessions to see some shifts. If they're in person, I treat 2 ways. Either I just do a session without conscious work, so they get herbal recommendations, dietary supplements, acupuncture, and low-level laser therapy, or they can do another type of session where they get that plus they get the conscious work.
Awesome. That's incredible. And then I actually think that you could help couples as well. I imagine the work you do can also heal relationships. Can you tell me a little bit more about that?
Yeah, I'm smiling because I never do relationship work with them together, because it only takes one person to be conscious to heal a relationship. My teacher Gila Golub, she has 2 episodes on my podcast. I love it. She says relationships are not here to make you happy; they're here to make you conscious. So they're your greatest teacher. And to share some stories, when people do this work, because again, I promise one of 2 things happen if the shift happens when you really do this work. One is your perception to the situation changes, and 2 is the external environment changes. So the first one is your husband, it just doesn't bother you what he's doing. Like you just don't see, you're literally not triggered. You're not ignoring it. You're not surprised. You're not triggered by it. You feel differently based on it. Or 2 is his behavior changes. This was actually my aha moment when I discovered conscious work. I was always a seeker. When I was a CPA, I was still showing up at these mind body workshops. It would be, I was in my 20s. I had been trying to change the external world to feel good. If just my staff were this way, if just the government was this way, if just my wife was this way, then I'd feel better. And then I realized if I just change me, then my perception to everything else would change. And I was like, I can make me a full-time job. That's a lot easier than trying to change everybody else. So for conscious work, when it comes to relationships, it just takes one person. Why? Because when the person who is conscious is in a relationship, one is they don't need their partner to be a certain way for them to feel good. And neediness is really uncomfortable. It's unattractive. So the partner's not feeling that need anymore because you're tapped in, getting it filled another way. You're not looking for them to fill you up. 2 is, remember, notice, don't take it personally. When your husband is an ass, you're curious what's going on for them. How old are they in this moment right now? Like what program are they running? And you're not making it about you. You're not taking it personally anymore. So you're not at the effect of it, right? So that's why it helps. And the other person has temporary relief because every human being wants to be seen and heard. That's how we feel love. This is to quote Gordon Neufeld, local attachment therapist here in Vancouver, also on the Conscious Fertility podcast. So when you're conscious, you're able to be present, hold the space, and hear them. You don't need them to see and hear you because you already do that for you. So when you become conscious, you're no longer looking for the external world to validate you. Yes, It feels good when it happens, but you're very clear that those are temporary pleasure feelings. They're not your nature. When I talk about you are happy, your very nature is peace and joy. That's why you're happy.
I love it. Like some tea. Well, thank you, Dr. Lorne Brown from Acubalance Wellness Center in Vancouver, British Columbia, Canada. We love you. Thank you for all the work that you do. And I have a feeling that this podcast episode will be shared for years to come. Thank you, Lorne.
Thanks for the opportunity, Aimee.